Hello, good morning. My name is Dr. Tofiq Bohra. I'm an oral maxillofacial surgeon and unit head at SL Raheja Hospital, Fortis Associate. I have two major fellowships, one in Cleft and Craniofacial surgery and the another in TMJ Arthroscopy and total joint replacement, which is from University of Maryland, USA. Today I have come in front of you to talk about my department. TMJ and TMJ disorders is a complicated matter. The patients suffering from TMJ disorders normally have difficulty in chewing, talking, and performing other activities using the joint. Temporomandibular joint is the only joint present in the face on both sides, with the help of which the patient opens and closes the mouth. Problems with this joint are less noted and the people are less aware about this problem in the society. However, it is catching up with the population and more patients are today coming up to us with this kind of problem. We at SL Raheja Hospital have a totally dedicated department for TMJ disorders, including minimally invasive surgery, also known as keyhole surgery, where we do not need to perform an open joint surgery and we get the job done with just 2 or 3 small holes in near the joint. SL Raheja Hospital also has laser equipments available to deal with this disorder, and I feel immense pleasure in saying that there are very few centers all over the country who manage these disorders, and ours is one of the first center which deals with this problem at an extensive scale. Along with TMJ disorders, our department is also involved in tandem with the accident and emergency trauma department, where we deal with facial traumas. We are capable of managing the fractures in the face as well as reconstructing the face at all levels. We work in very close proximity with the orthopedics who are also involved in fractures. Apart from that, we also deal in a great amount with the oncology department. After a patient has undergone a cancer surgery and they are not having teeth or jaws in their face, we are in position to rehabilitate that patient, and that patient can have a better social acceptance as well as a good set of teeth for eating and performing further functions with the help of dental and craniofacial implants. I take immense pride and pleasure to inform that SL Raheja Hospital has been our backbone, and my department is ready to perform all these surgeries at the most extensive level, and we are equipped to manage all the complicated cases over here in the department of oral and maxillofacial surgery. Thank you.